We are here today to demonstrate how to correctly set up a large volume nebulizer. The equipment that you will need is a large volume nebulizer, which consists of the water reservoir and the nebulizer head, an aerosol mask, 6 feet of large bore tubing, a pair of scissors, and a drain bag. First, to start off, you want to make sure your hands are washed and you have gloves on. Next, check the patient's chart for current physician's orders. Identify the patient by using armband and ask their name and date of birth. Assemble the large volume nebulizer by attaching the neb head to the sterile reservoir. Be cautious not to contaminate the equipment by touching the opening of the reservoir or allowing the neb head to come in contact with anything else. Set up appropriate FiO2 according to orders on the collar of the neb head. Attach to the flow meter at the oxygen outlet on the wall at the patient's bedside. Attach the large bore tubing to the end of the nebulizer. Attach the aerosol face mask to the other end of the tubing. Turn the flow meter on to 15 liters per minute. You always want to turn this on before putting the mask on the patient. Put the mask on the patient. To help avoid condensation buildup, you will want to insert a drain bag into the tubing. To do this, find the lowest point in the tubing and cut. Insert the drain bag by attaching the tubing that was just cut on both sides. Large volume nebulizers are used on patients that need humidity or their upper airway is bypassed. For example, they have a trach or endotracheal tube. If the patient has an endotracheal tube, you can attach a Briggs adapter with 6-inch tubing right onto the ET tube. If patient has a trach, use a trach collar and put right over the opening. If patient has trauma or burns to the face, use a face tent to allow aerosol to blow to the patient. That's how to set up a large volume nebulizer. We hope we were able to help.